For the next disease condition which will be establishing its link with heart failure in children is a chronic renal failure. Alright, so chronic renal failure. So chronic renal failure could actually lead to heart failure in children. How? Okay, so let's establish this link, okay, between this, okay, in children. So what we have here is this. Of course, chronic renal failure is the kidneys are not being able to put out waste products like they should. Do you understand? Put out urine as they should. So of course you should be suspecting that there's a backlog of urine in the body. Not urine, backlog of fluid generally in the body, you know. So as an introduction, we said that chronic renal failure can significantly affect the heart function, especially in children. Okay, so there's a whole lot of cardiorenal syndromes. Do you understand? Issues of the heart, and these issues of the heart are simply coming in because, you know, you have a complication from the kidney. So this vicious cycle where kidney dysfunction worsens heart failure and worsens heart function, okay, and also if there's the heart functions is worsened, it also affect the kidneys, vice versa. Okay, so let's look at the various linkages between these two organs. Okay, so first of all, if the kidneys are not excreting waste products effectively, these waste products are where they are backed up in the body. Do you understand? So it leads to the heart having to deal with so much fluid. Now the heart struggles to pump the excess fluid. The heart gets tired. That's congestive heart failure. All right, hypertension. So chronic renal failure usually activates the renin-angiotensin-aldosterone system. So it causes your blood vessels to actually become smaller in diameter. So this could actually lead to what? Hypertension. So persistent high blood pressure increases after load, making it harder for the heart to eject blood. So over time, it leads to left ventricular hypertrophy and dysfunction. Okay, so anemia too. So chronic renal failure, you know that the kidneys produce erythropoietin. Okay, so if erythropoietin production is not being sufficient again, all right, then you know there's a whole lot of issues. Okay, your red blood cells are not being, you know, sufficient again. So uremic toxins, so accumulation of toxins like urea, creatinine can directly depress cardiac function. This contributes to what? Uremic cardiomyopathy is a form of heart failure that is seen in advanced kidney disease. Okay, electrolyte imbalance too. So chronic renal failure often causes hyperkalemia, hypocalcemia, and acidosis. So this can impair cardiac conduction and contractility, increasing the risk of the heart beating abnormally. Okay, vascular calcification. So sometimes the position of calcium could actually be there. Do you understand? Okay, deposited in the coronary arteries and heart valves. This can disrupt it. Okay, it stiffens the heart muscles and the blood vessels. Of course, it will lead to a whole lot of complications. So that's how chronic renal failure could actually lead to heart failure, all right, in children.